Hello, everyone. Thank you for joining us. We're excited to have you participating in our youth online town hall. My name is Camille Lang. I'm with San Mateo County Health, and I'm joined with Shri here. Thank you, Shri, for being here. We're just going to wait a couple minutes as we have people tune in. As we're waiting, we'd love to know where you're tuning in from in San Mateo County. Are you tuning in from Redwood City, Half Moon Bay? Is it cold outside? Is it warm outside? Let us know.
Hey everybody, I'm so excited that we have you guys here. Hi Camille. Thank you so much for taking some time in your afternoon or evening today to listen more about COVID-19 and what San Mateo County has in store. And definitely, please let us know where you're tuning in from. And if you have any questions about the vaccine or COVID-19, we can address them at the end. And feel free to always add those questions in throughout the presentation. We can always add more and have our panelists, which will be later on, answer some of your doubts as well.
Great. Thank you again for tuning in. Shri, I'm going to let you take it away if you're ready.
Yeah, for sure. All right. So before we begin, we just wanted to share the breakdown of what's going to happen in the event. We're going to have a short presentation about COVID-19 and what San Mateo County is doing for it. And then we will have panelists answer some questions I have prepared about the vaccine. I'm also very curious about it and would love to learn more about their input. We have some youth panelists, mental health specialists, and some physicians and staff to help us out here. And afterwards, we can answer some of the questions the audience may have about COVID-19, what the county is also doing. And so, yeah, we'll start with the presentation. So I guess in terms of what San Mateo County is doing for helping reduce the number of cases in the county is by looking at individual cases, such as tracking people who have been contracted by the virus, using that sort of contact tracing to figure out where they might have gotten it, how it might have spread, trying to help people get quarantined and isolated so they limit the amount of time they spend outside with others in order to prevent the vaccine from spreading. In terms of community prevention, we have the social distancing orders, shelter in place. I know it's been a long time, but we're working towards getting everybody out and about again. Schools, of course, is closed, as you guys know, and we're having a lot more travel restrictions and stuff like that. Here are some general symptoms people have mentioned that they have received when they've contracted the virus. And this could be anywhere from having fever, chills, to headaches and nausea. The very interesting thing about COVID-19 is that many people who test positive don't show a lot of symptoms at all. And these types of people are known as asymptomatic. And they don't know that they have the virus, but they might be doing a lot of interaction with other people, family, and friends. So it's important that we know some of the symptoms and get tested so that even if you are asymptomatic, you can reduce your exposure for spreading the virus. So who should get tested for COVID? These are people who have symptoms of COVID-19, as mentioned earlier. People who have had close contact with other people, whether they're within 6 feet, or you might be a little bit closer, or with a lot of people. And people who have taken in activities where they've just been in a crowded area with and mingling out and about. And so we want to make sure that if you fall into any of these categories, that you might want to talk to your provider or just find a COVID testing site and get tested. In terms of current infection, you can test for the virus by using a the swabbing method, which is basically you take this little cotton swab, not really cotton, but the swab, and you put it into your nostril and you just swirl it around a bit. It's not painful at all. I've done it before. It's totally okay. It makes you sniffle a little bit, but then you put that into a vial and send that to a lab that basically checks to see if there are any viral sort of particles that are present, and we'll send those results back to you to help you know that if you are positive or not. So this is a dashboard of the county data that they've been receiving about the total number of COVID cases. And as you can see, there are around 42,500 cases and 581 deaths around the county. And from the bar graph, you can see from the left-hand corner, it might be a little bit blurry, but it shows that a lot of people in their youth and a little bit older have been getting the virus and testing positive for it. So that's why we're all here. We're all here to explain that, hey, we want to help promote the youth to stay safe and also get vaccinated, because the majority of cases are sort of bunched around in that center area. This is also another breakdown of the COVID cases based on county. What's really interesting about this is that the darker the shade of blue that is in that county, it means that there are a lot more cases there. So we can see San Mateo, Redwood City, and a lot of different counties having a really dark blue area, meaning that there are a lot of COVID cases there. This doesn't mean that, oh, if I'm in a lighter blue county, I'm fine, I don't need to take the vaccine. We all know people love to travel around all over the Bay, and so we don't know if you might have accidentally interacted or with somebody who might be from a county with a higher number of COVID cases that might be asymptomatic or tested positive. So it's really important that we all in the county stay safe and get the vaccine so we can limit those exposures that might even happen through travel. This is another sort of breakdown about the total number of people who have gotten vaccinated. And so we've got around 579,000 people, and around the age 16 years and above, we have around 88.5% of people vaccinated. So we're getting there, we're getting super close. We really want to bring up that number as high as possible. In terms of 12-year-olds, we have almost around 87%. So it's very close. One thing you might be wondering about for why that number might be a tiny bit smaller than the 16 plus, it's because the vaccine being eligible for 12-year-olds and above came out a little more recently, so it's still an ongoing process for younger people in the county to get their vaccine. But we really want to bring up those numbers so that we can get closer and closer to that herd immunity. Here we have a chart sharing the inequities that we have with COVID-19. So a lot of this is a breakdown based on race and ethnicity. So for Alaska Native, non-Hispanic people, they have 1.6 times higher number of cases compared to white and non-Hispanic people. Their hospitalization rates are 3.3 times greater. The death rates are 2.4 times greater. So we see that with being a lot higher in compared to non-Hispanic and white people in terms of the Alaska Native Hispanic population, Asian and non-Hispanic, African American communities, and Hispanic or Latino communities. And this really shows that sometimes resources might not be shared across the board to other communities. And so that's where we come in and try to help out by having the county promote people to get vaccinated and reduce the inequalities that are happening around. So in terms of who's eligible for the vaccine, it's anybody who's 12 and older. Only the Pfizer vaccine has gotten the US Food and Drug Administration's emergency use. So that means that they can use the Pfizer vaccine for anybody who's 12 to 17 years old. And if you're curious to why somebody should not get the vaccine, It's for people who have had an allergic reaction to it. Usually when people get their first dose, they have a 15-minute waiting time period, and in that waiting time period, people get some sort of allergic reaction or, losing breath. And in that situation, that's when we know, okay, their body's not really taking this in well, and that they might need some sort of medical attention to help. And the way that they get that medical attention is through epinephrine, probably like an EpiPen, being there for them. In terms of how the vaccine works, really, I guess to take a step behind that curtain from the science and talking just about how it works in a way that's just really easier to digest, it basically teaches your immune system to recognize the virus and fight against it. We are teaching the body that, hey, there's this virus particles they're not real, so you don't have to worry about that in your body, and your immune system recognizes it and then is able to know that, hey, this isn't part of me. This sort of substance that's inside of me is foreign to me and wants to go and attack it. And basically, by doing that, it builds an immunity and protects you from if you actually do get contact with the virus. And people are considered fully vaccinated 2 weeks after the second dose of the Pfizer vaccine. So is the vaccine safe and effective? The CDC has mentioned that it is. A lot of people are definitely worried about side effects, which is totally okay. Everybody's very concerned about the side effects that they might have, but they're really common and really showing up after the second dose. And something interesting, I guess, would be to know that the Pfizer vaccine is 95% effective in preventing infection, and or 90% or more effective in preventing severe illness. But really, any of the vaccines that we have are very, very effective in lowering, the number of cases we have, because it really builds your immunity. And the CDC is also monitoring reports of myocarditis and pericarditis in adolescents and young adults after their COVID-19 infections, because a lot of people, there has been some interesting cases that are happening where people are mentioning that they have this sort of health stuff happening to them. And yes, it sucks. For 2 days or 3 days, you feel really sick, you want to just stay in bed, but after you go through that really big hump and challenge, you really are going to be able to be safe and can really go outside and meet your loved ones and really have that sense of normalcy come back after such a long time being, quarantined and isolated. And the CDC recommends that the vaccine can be for anybody 12 and above. Some side effects from the COVID vaccine are that you can have pains, redness, swelling, and this can be on the arm, versus you can have, tiredness, headaches, muscle pain, chills. This is all just to show that it's very, very normal to have some of these side effects. A lot of other people are experiencing it. So if you're afraid that, oh no, I don't want to do this because I'll have this on me, it's totally okay. And it's temporary as well. So some sort of tips and tricks to help with those side effects and reducing them are that you can apply a clean, cool, wet washcloth over the area and just exercise your arm. The number of times I see people, doing the windmills with their arms and their shoulders is that it might be effective in trying that. And so moving your body around and just doing your daily routine work can help with that. And to reduce discomfort, you can drink plenty of fluids and dress lightly. You might be feeling very warm, so it might help to do that. Also, you can talk to your medical provider about taking something like ibuprofen, aspirin, Advil and stuff like that in order to reduce the pain. So after you've heard all this information, what do you need to do as a community to help reduce the spread? Of course, as we've been hearing around in the news, always please stay 6 feet away from other people. We want to have that social distancing. We want to limit the amount of contact we have with each other. Also, remember to wash your hands for 20 seconds, sing happy birthday a couple times, get those grooves in areas, and do it throughout the day. And always prevent from touching your eyes, nose, or mouth, because those are points of entry for where viruses can come into your body. And I think, as we've all learned from like kindergarten and elementary school, cover your cough and sneeze. And if you are sick, please do stay home, and from work, you want to sort of isolate yourself just for that time being, so you know that you won't be a source of spreading the virus. And of course, if you have difficulty breathing, fever, or cough, it's okay to call your doctor's office. They'll probably give the medical attention you need. So here are some sources that you can have in order to be able to be of help during this critical time. You can deliver meals, donate to a shelter and food bank, volunteer, and support nonprofits. And this is through the Calling Healthy Californians. And you can get to that site at the right bottom hand corner where it says serve.ca.gov. Another resource we have is the San Mateo County Strong, where you can donate and help fund for the schools and businesses that have closed, and the nonprofits that are, facing a lot of demand because they don't have staffing resources, since everybody's trying to get quarantined. Another thing you can do is donate masks and respirators or gloves that you might have. A lot of people have been sewing masks and, gone on YouTube, did a little quick search, and used any fabrics and cloths they had at home. So if you do have some time, it could really help the first responders and other healthcare organizations and community in general. All right, so as I bring this to a close, this is the vaccine clinic schedule that's actually taking place all around the San Mateo County over the summer from July to August. It's Tuesdays through Sundays, with an exception on Mondays as a holiday, where you can come at any of these times to actually get vaccinated. You don't have to sign up. You can just show up and get your vaccine and be ready to go. And these are at different areas. I think one is the vaccine clinic will be happening at the San Mateo Medical Center. But specifically on July 24th from 9 a.m. to 6 p.m., we will have sort of like a county fest in a way, where we'll have music, prizes, raffles, and a really good time where we're bringing the community together and have students youth basically vaccinated, which is the perfect time right before school. And yeah, that's all I have. So after the presentation, I mentioned we're going to have a panel discussion. So you can definitely use the chat box to share reactions, any comments or questions you also have. For the people who have joined us, feel free to ask any questions in the chat. We can get to that. And there are so many resources available. We can share that to you so in order to help. And so now it's time for our youth and health providers during the panel to come on and answer some questions that I actually have and some of the other audience members do. And they will include questions specific to the youth, panelists, and the providers. And we ask that the audience will stay muted during this portion, and then you can ask your questions during the Q&A, which will happen right after. And so for our panelists, I ask that I call you guys up. You can introduce yourself, your name, pronouns, and what part of San Mateo County you represent. So from the youth panelists, we have Yvette Morales.
Hello, everyone. My name's Yvette, and I'm from San Mateo, and I am a health ambassador from the HAPI program with Star Vista.
Nice to meet you again. And we have Amaya Nori.
Hi, everyone. My name is Amaya Nori. I attend Menlo Atherton, and I represent the North Fair Oaks area, and I'm part of the San Mateo County Youth Commission.
And we have Ala.
Hi, everyone. I'm Ala Alize. I'm part of Burlingame, and I'm from the Health Ambassador Program for Youth, so the HAPI program extension from Star Vista.
So those are the people we have for our panelists. In terms of our medical experts, we have Dr. Mithu joining us.
Hi, everyone. My name is Mithu. I am a doctor with the San Mateo Medical Center. I oversee the Daly City Youth Health Center and the Sequoia Teen Wellness Center. It's great to be here.
And we also have nurse practitioner Tamar.
Hi, everyone. I'm Tamar. I'm a nurse practitioner at the Sequoia Teen Wellness Center. I also facilitate the youth advisory board for the youth, for the teen clinic.
Yeah, and we also have a mental health expert, Cindy Donis.
Hi, everyone. I provide mental health services through the county of San Mateo. Nice to be here.
All right, so these are the people who will help us out and answer some of the questions that we have. To start off, I have some questions for the youth. We can start with Yvette. So what were your thoughts about getting vaccinated?
So my thoughts about getting vaccinated, I never had a doubt about it because I always had trust in the medical professionals and what they were saying, encouraging us to get vaccinated so that we can slowly but surely get back to a normal life. And I think that's something that really motivated me to get the vaccine.
Did any of the other youth feel something similar or different?
I can say that I definitely felt the same way. I also had mixed feelings, I guess, about getting vaccinated because I wanted to like move around freely and like get out, like not get out of my house. But I also realized that there were a few risks with the vaccine, and I was just scared about the after effects.
So you mentioned risks and after effects. Could any of the youth really talk more about that? I'm curious to know what were some of your fears.
I think I can talk about my fears. So I actually did get a few reactions, a lot less than what some people were experiencing, but I did have like pain, the location of the arm, but that went away, after a few days. And then I did have like a rash, which is less common, but like it was just itchy around that arm. So it did make me a little bit nervous, but I realized that, there's so much research that was put into developing this. There is so much science to back this up. The Pfizer vaccine is officially FDA approved, so that means everything is backed up and double checked as if it would have been a normal vaccine rollout and like a normal vaccine that you'd have to take to go back to work or to school or something like that. So that made me very confident in my decision in getting that vaccine, very confident in, accepting that these reactions were going to go away within a day or two, which they did.
It's really good to hear that you had a lot of belief in the science and the CDC, in just knowing that this will really help you out. I guess a question sort of for that segue would be for Mithu. We had some of the youth mention their side effects and such and their fears. Are these really common? Are these serious side effects, or are they out of the blue?
So it's a great question. I think probably most of the youth here who have received their vaccine can speak to this. We see that It's like 70% of people who get the vaccine. So 7 in 10 do have some sort of side effects. Side effects are things like your arm is super sore, headaches, feeling super, super tired. I see some people nodding their heads. That might sound familiar. What we see is that for most people, those side effects go away in about 2 days, if not sooner. And some people don't have any side effects. Not having side effects does not mean that the vaccine is working. It is working. And those side effects, if you do have them, including things like the rash that you were mentioning a lot, are totally common and expected.
That's really interesting to know. I guess adding more onto that question I have for Tamar, how can vaccine side effects be treated?
Yeah, also a good question. Taking Tylenol, be sure that you're well hydrated. You could put ice on the site. That can cool things down a bit. A lot of people will take time off work or stay home, don't plan a really busy day the next day, and that's usually quite helpful. Any of those things are quite helpful.
Yeah, so now that we've talked about the science and some of the fears we have, and that physically that our bodies will be fine really after taking the vaccine, there is a little bit of fear from what I'm understanding, right, that you still are a little hesitant to take the vaccine. So I guess my question would be for Cindy, what are some ways that we can sort of reduce that anxiety and fear we have beforehand or even after taking the vaccine?
Thank you. Well, I think, anything that is new to us, that is unknown, is going to give us a little bit of anxiety and fear. So some of that is normal and it's common. And I think when we have some fear or anxiety, it's best to probably stick to one or two sources that we're going to read on, maybe going to the CDC or places that we know are trusted for information. So we can start reading mostly from one or two trusted sources. But it's also common to have a little bit of fear that you're going to feel sick. After a year of being afraid of being sick at all, it's common to feel that, even if you know there's side effects. So know that some of the anxiety and fear is normal and that that's okay, that there's a lot of people that are probably feeling that way. And that if you do feel the side effects and that brings up a little bit of anxiety, perhaps before the vaccine, plan on ways that you plan to take care of yourself in that, have some activities that aren't going to create too much stress, but that, help relieve some of your anxiety so that you have those ready to go when you do feel some of the symptoms, if you feel the symptoms, because not everyone does.
Yeah, that's interesting to know that, we're all human and we all have these fears and they're all normal. Going back to our panelists, I guess I'm sure it's been a while, right, since you've gotten your vaccine. How do you feel now? And we can start with Yvette.
Yeah. Okay, so I feel much more protected. I at first thought that once, June 15 hit and we could stop wearing masks when we're outside, I thought that, me being vaccinated would allow me to, be more free with my mask. But it's become such a part of me that I just wear my mask wherever I go, even though I do feel safe already. And my family also got vaccinated, so I'm really happy about that we're all safe here. And that even if we do get COVID, which I hope doesn't happen, that it's not going to be so severe that we're going to be sent to the hospital.
Right. I guess the question, at least that I have, is I have been vaccinated. Do I really need to wear my mask or should I keep it on? And this would be directed to, we can do with you first.
Did you say me? I'm so sorry.
No, yeah, no worries. I'm just confused. Would I really need to wear my mask?
So if you've been fully vaccinated, meaning that you're 2 weeks out from the final dose of your vaccine, so after 2 weeks after your second dose, if you got Moderna or Pfizer, and then 2 weeks after your first and only dose of Johnson & Johnson, you're considered fully vaccinated. And according to CDC guidelines currently, you can go unmasked outdoors as long as it's not too crowded. You also, if you're fully vaccinated, can be indoors in some, according to CDC, but it seems like that those guidelines may be changing a little bit. So you just kind of need to keep an eye out on what the most current guidelines are in the area that you're in.
Right. Things, yeah. As speaking of sort of things are changing up, I'm hearing that there is a new Delta COVID virus for Tamar. Could you explain what this Delta virus is, and is my vaccine okay for it, or do I need to do something more?
Yeah, the Delta variant. So with any virus, viruses want to live. So they do whatever they can they change so that they can continue. So that's what happened, as well as there was so much COVID in the community that there were mutations, there were changes in the virus, in the structure of the virus. The Delta, why we're so concerned about the Delta variant is it's much more contagious and it's much more serious. It's much more severe. It comes on quicker. It's just much more contagious. We're seeing younger people with the Delta variant, and we're seeing them get sicker than we had been with the earlier variant. So the vaccines have shown to provide protection, a fair amount of protection with the variant.
So we are in the clear. That is very reassuring to know that at least the effort that we're making, that one small step to get that first and second dose, really does play a long role. I guess something more to go on the realm of this is that for those who have been vaccinated, how were you able to convince your parents? Is that something you guys were worried about for the youth? I can start with Amaya. How was that confrontation you had with your parents?
So I guess my parents encouraged me to get vaccinated because they knew that sure, there are some risks, like I think it was myocarditis and like blood clotting. They said, yeah, there are risks, but they think that they feel that like the benefits of getting the vaccine definitely outweigh like the risks or the rare chance of an after effect.
I think to go off of what Amaya said, which is really important, is like thankfully I had a very supportive family. Like they're very they're very for the vaccine, very back at they feel that it's our moral responsibility, which you might be hearing a lot in society, to take care of yourself but also to protect others. But I have known a few people where their parents, it's that idea of something being so new or like you don't have an understanding of, and like someone that doesn't come from a STEM background, I understand how frightening that can be, just because it's a lot of words and a lot of things that are very unfamiliar to you. And thankfully I come from a STEM background, like from my college background, so I have a little bit more of an understanding, so I'm able to help educate my peers that don't have an idea. But I think everything starts with a conversation with your parents to say, hey, I'm thinking, I see these CDC and FDA and all these high profile doctors and scientists and very reliable sources saying like this is something that we should be doing to protect ourselves and others. Maybe we should, look into it, or maybe we should reach out to someone that knows reliable sources, or reach out to your primary care physician or something like that, just so you can have a starting point to get more information, get yourself more educated on the vaccine.
That's really great to hear that you were able to use what you learned in school, whether it be, college or high school, for the youth that, have been taking those science classes. Like it really is an application of what you learned in the classroom to what's happening in the world today. So that's fantastic to hear. I guess let me post some sort of like scenario for the youth here. Let's say I am an anti-vax parent, and you are my children, how would you go about convincing your parent who has authority to, convince myself to take the vaccine, or even yourselves to get the vaccine? And we can start with Amaya.
So I guess the first thing I would do is just ask them what they're like, why they have this feeling for like to not get the vaccine, and why like they're not comfortable with it. And then for like, I think a few reasons, popular reasons are like not sure of the what goes inside the vaccine, like afraid of the after effects that I mentioned before. So I guess first, like to answer the what goes inside the vaccine, if I remember correctly, all of the I guess ingredients for the vaccine are listed on the CDC's website. So I would just show them that and try and prove to them that all of the things that go into the materials and materials that go into the vaccine are safe. And yeah, to answer the second part about how if about the after effects, I would say that sure, like I said before, there are like a small chance, or like a small rare chance that there could be an after effect, but the benefits of getting the vaccine to keep yourself safe definitely outweighs it.
Yeah, that's a very clean-cut way of just saying, like, show the facts, show the science. That's really all there is to it. And I'm really glad that we have young, educated, mature youth that aren't afraid to take that leap of faith in talking to somebody who, might have authority, or you might be really afraid to talk to. So that shows that youth are really powerful and that they can take that stand. Going along those lines, again, another question for the youth. How has your experience been sort of interacting with your peers and friends about the vaccine? Have you had any interactions where some people might have been hesitant? Anything on that? And we can start with Yvette.
Right. So I have had a few instances where I've had some friends that say, oh, I'm not going to get the vaccine. The exact reason for it, I'm not sure, but I think the major reason is because they don't trust it. They don't know what is in it. They're not as educated about, what goes into this vaccine and what it does, when you're injected. And I think the majority of it comes from all these crazy ideas that, that are put in people's minds, that we're getting chips put in us, that there's weird ingredients in the vaccines. So I definitely think that meetings like this can definitely encourage youth to get the vaccine, because they're learning more, and they'll be, a little more confident about their decision to get it.
Yeah, spreading information, sharing the word, that's what we're all here for.
I did want to add, sorry, Sheree, I just wanted to add on to what Yvette was saying, is I think that a lot of, this being scared, like what Cindy was saying, comes from misinformation too. So I know, like, the youth, myself included, like, we have Instagram, Facebook, Snapchat, Slack, whatever we're using. There's, abundance of information out there. However, not everything is true. So, even TikTok or like these other apps that we might use, you get information or videos or people that are not, doctors, physicians, researchers, health care providers, people that have spent their whole lives or, gone through actual training to understand like this virus and this vaccine. So I think it's the idea of trying to filter out misinformation and trying to get like the brunt and the brute facts that we need. And then I think learning, that's a learning curve for all of us to do, because it's just very hard for anyone to do. We assume that everything is truthful and everything is credible because we all like to have, the benefit of the doubt. But I think that is one step that we could take to learn how to filter the misinformation and go straight to the sources like the CDC or the FDA or the San Mateo County Health website, and actually look for like the resources and articles that we need to help us educate on what actually, like Amaya was saying earlier, is in the vaccine. What are the side effects, the risks, all these extra stuff.
Yeah, I love this. I really do. It makes me feel a lot more confident that we can actually really do bring this down and that it's not like we feel really alone in this. So thank you so much. Question for Amaya. What are some helpful things you might say to a youth that might be hesitant to get vaccinated? I think we talked about parents, but yeah.
Yeah. So I guess first I would say just to look at the facts. Like right now on the internet, on social media platforms, there are just so many good like sources for you to find information about the vaccine and like why like the benefits of the vaccine and just reasons why you should get the vaccine. And I would just tell them that they should just check it out. Like they don't have to change their mind, but just by checking it out, it would be a big step for them to like get almost getting the vaccine. And I guess I would tell them to like just, in my opinion, I guess like when peers see or when young teens see one of their peers getting the vaccine, they're going to be more like enticed into getting the vaccine, and they're going to like they're going to want to get the vaccine too, as like teens are like to follow their peers. So just like look around, look at your peers, and just look at the facts.
Yeah, being a leader, taking that step as being a role model is so important. And I guess you really broke down the psychological perspective of how people want to do the cool things that other people are doing. And so maybe taking the vaccine is cool, regardless of what you think about science. So we can play that card out. So there's been a lot of talk about these sources. I kind of want to bring out the elephant in the room. What are these sources? How would you tell somebody, for example, I don't know anything that's going on. What do I check out? What are the websites?
I think I mentioned a few earlier, but I think the biggest one right now that might be the easiest website for all of us, and it's all over the news, is the CDC website. That's the one that I primarily use for, thank you for putting that up, the reliable CDC.org, that is down at the bottom of the screen. But that's where you could get the most up-to-date information. They update that almost on the daily or weekly or whatnot, but it changes per state and per county. So the two probably that are most important are the CDC and then the San Mateo County of Health, because you can see what changes are happening. If you want also, if you're kind of a nerd, or you just really like reading more stuff, they have all the clinical trials and vaccine information about these vaccines online. You can go on Google Scholar or on PubMed. I actually read the clinical trials for the Johnson & Johnson. This is for a class, so I didn't do it out of my own fun, but if you want to, this is where you can find it. The Johnson & Johnson, the Moderna, and the Pfizer. And it shows you how they did their research and everything. And I can vouch, because I read it and you can find it online, it's accessible, that it is successful and it is proven effective. So, and I think, yes, also contacting your primary care physician is a great start and a great person to contact, because these people have gone through years of medical school, medical training, and everything like that. So
yeah, always feel free to click that www dot and put that healthcare provider, and I'm sure they'll have some stuff on their front page open and center, and you can start clicking on some links. Another question I have, standing away from, again, that sort of physical stuff that's been happening with the vaccine, mentally, do any of you feel some sort of fear or anxiety in terms of going back to school? I know school starts in around a month or so. How are you guys feeling about that? And we can start off with Yvette.
Right. So I'm a little scared. I mean, most of us, if not all of us, have gone a year without being in person school. I know towards the end of the school year, some people were allowed to go back to school if they chose to. I'm a little scared because I haven't seen these people in a while. I don't know if they've changed. The new fear of, oh my God, if someone has COVID and they're not vaccinated, what am I going to do? So like you have all these questions and you're really wondering, is it the safest thing to do right now, or should we wait? But I mean, I don't think we really have a choice, I think, in-person school for 2021.
Yeah. Is anybody, in college here? I'm curious because that means 150 people lecture halls with one professor sitting right by you. Do we have anybody like that? And somebody at least being in a big area like that? Let's say I want to go see a baseball game or a football game. That also means a stadium full of people. What are your thoughts about, going to something like that?
I think I might be the one youth that's in college. Are you guys in high school, the other youth? Okay, good luck. You guys are on the right track. But yeah, I am in college, and so my fears are kind of that, coming back. My university was a little bit slower on figuring out the COVID-19 regulations and how they were setting everything up, but they have allowed for 6 feet distancing, and they haven't changed anything yet. So it's a hybrid high flex situation, but I think there is going to be that, weird feeling that we all get. I haven't seen my friends in over a year, other than FaceTime. Being in person is very much different. We're going to be required to be wearing masks. So that's also a little, different interaction. I think it's something that we should very much, keep up and do. But I think it's just it'll be a different feeling. I think we'll be extra cautious, I think. It won't be 100% normal, but it's a step forward.
Yeah.
I don't know how that has gone for you guys, because I know it's a little bit different when you're in high school, just because I think you guys are from the same area. I don't know if your experiences are the same, where you'll be coming back to all the same people.
I know for me, I will go to university for the first time, and I don't even know how that's going to work. So I will definitely be very nervous, and I will probably stick around with like my 10 or 5 or my roommates, just our little bubble, just to be safe. But yeah, if any of the other high school students want to add on, totally love to hear that perspective. And we can start with Amaya.
Sorry, could you repeat the question?
Yeah, how you're feeling about going back to school, I guess in high school, where it's not like 150-person lecture, but still you're around people in a very intimate space, right? 30 people, 40 people with a teacher for a good amount of time.
Yeah, so I guess like I would have like a few worries about like going back to school, but I do think that like majority of the kids and students in our area have gotten vaccinated or are planning to get vaccinated, which I think is really good. But for the small amount of people that like aren't like that don't want to get vaccinated and that aren't vaccinated, I do feel like a bit worried. But I feel like I got the vaccine, so I should be pretty safe. Like for majority of the time, I should be pretty safe. And I just would like them to get the vaccine too, just for the safety of all the students at our school.
Yeah. I'm also just curious, which vaccine did the 3 of you get? I would want to hear all of you guys for this, because I want to see if there's maybe some differences, and I want to sort of pick out at that. So we can go Yvette, Amaya, a lot. Which vaccine did you get?
Well, I think for youth, the only one that has been approved for us, like our age from 12 and up, has been Pfizer. But then I think 18 and over, Allah, I don't know if you got a different vaccine, but I think most youth got Pfizer.
I got Pfizer. That was the only one that was there, but I would have taken any of them.
Okay.
It was so hard to get an appointment when I got it, so I was like, give me whatever is left.
More about appointments. How hard was that navigating for you? I've heard some youth say, like, every time I put in my information, like, whatever that site wasn't able to get through, and I never got an appointment. I kept trying for weeks. What was your experience like trying to get an appointment for that?
I can start. So for my age category, I think it was 15 and over was allowed to get vaccinated starting April 15th. I was up till 12 a.m. I was on what's it called? There was a website where you can like type in your zip code and find where you could have an appointment. And I looked at CVS, I looked at Safeway, Rite Aid, I looked at every health provider that I could, and I could not get a vaccine until end of April. So I tried that first day we were allowed to, and it was all full, and I had to wait.
Yeah, that first day where everybody was like, all right, we're gonna wake up at midnight, go online, get that appointment, push the imaginary people away, saying it's my turn.
It was vaccine Black Friday for us.
That is a really good way of putting it. It really was a Black Friday hassle, even virtually. Question I have, I guess. Well, yeah, the good thing now is that vaccines are a lot easier to get now, especially because we have the vaccine clinics happening all over the summer, and you can get them locally and don't even need an appointment. Don't have to, be on the edge of your seat to get it. So just walk it right in and you can get it. Another quick benefit is that if you are a youth who wants to get it, you can also just come get it. Nobody's going to ask you anything. It's totally okay. If you need parental consent, because if you are under 18, you can always get a quick phone call with your parent or guardian and get verbal consent that yes, you can get that vaccine, and just in case if they can't come. So it's totally fine that way as well. So in this sort of panel and group of people, we all got Pfizer, including myself. I heard that Moderna for 18 and up doesn't do as well as Pfizer. There's something with some percentages happening here. I was wondering if that was the case, and we can get Mithu to explain more about that.
Sure, I can try. So I think the bottom line, or the kind of big picture, is all of the vaccines are incredibly effective at preventing severe illness, and that is what we care about. And so whether it's the Moderna or the Pfizer or the Johnson & Johnson, they're all super, super, super good, like so much better than most vaccines for most illnesses that we give vaccines for. So I know that there's been a lot of conversation around, well, Johnson & Johnson has estimates of like 70% versus Pfizer's 94%. Those studies were done at different points in time, so it's sort of hard to compare them against each other. What we're seeing in terms of real world data, which is meaning people who've gotten the vaccine, who's getting infected, the rates are going down in places where there are high levels of vaccination. Like right now, what we're seeing, and I know we talked about the Delta variant, is that the places where we're seeing increases in infections are really these hotspots where vaccine rates aren't that high. So this real world data tells us that where there are communities where most people are vaccinated, or high percentages of the population are vaccinated, the amount of COVID in that community, the amount of infection is low and dropping. So I'd say that's kind of the bottom line. The vaccine that you want is the one that you can get in your arm first and that works for you most conveniently. And obviously, if you're under the age of 18, that vaccine is the only one that's actually available to you is Pfizer. So just getting the one that has been approved for you and in a way that is convenient for you is what I would recommend.
Perfect. I don't even have to choose. It's great. I can just get whatever's already there. Less thinking on brain power for me to use, which is fantastic. I guess the question that I would get right after that is, I can ask this for Tamar. Why is Pfizer the only one 18-year-olds and younger can get? Why can't they get Moderna or something else?
Oh gosh, great question. That is what has been given approval. That's the only one that's have done the study, has gone through the approval process. And the other ones, I'm sure, are working on it and will be released as soon as possible. So that's why. Pfizer was making the vaccine first. So they were the first to be approved for the general population in December, and so they're first to be approved for the youth as well.
Right. So it's really just going back to that facts and data and trials that we have. And again, we're always coming back to the facts here. Speaking of more of the younger people we have in the community and even just globally, I was wondering for the youth, if you had any siblings, relatives, or younger family members or friends, how do you know if they're sort of willing to get the vaccine, or even if parents are hesitant because they're so small and young that, if they get sick, it's going to be really hard on them? And we can start with a lot.
Yeah, so I think it goes back to that conversation. Like I have a really big family. I'm one out of 9 kids, so there is a lot of people to get vaccinated. Thankfully, we've all been vaccinated. We have no one that's below 12, so everyone that needs the vaccine got it. But I do have a parent that has like a health issues. So that idea of having like I think it's called like a pre-something condition. I forgot what they call it. Pre-existing condition, yes. The word just slipped my mind. But having a pre-existing condition and having knowing that there's side effects to the vaccine and it might affect your immune system some kind of way was a little bit scary. But my parent that was worried about this talked to their primary care physician. They said this is perfectly safe for you. They did studies and everything. So especially like with where you are right now, like just go ahead and get it. Your appointment's available. Like just take the shot and you'll be okay, thankfully. So I think that's that whole idea of just having conversation with your doctor, because they know your medications, how your immune system and everything is working. So they're best fit to tell you if like this is a good step to go.
That's fantastic to hear that. Give your problems to your provider. They'll take care of it, right? If you have the fears, go talk to them. They'll give you a solution to it versus
Yes.
being conflicted inside. That's great. Yeah. As you guys know, we've all been at home for a really long time. It's been a wild ride. Everybody, I'm sure, has experienced it, like challenges one way and another. How has youth mental health been affected during this pandemic? I would love to hear from Cindy about this.
Sure. Well, like you said, we've all been home, right? We have adults, young children, teens. And, for you that are teens, you all know that you're still growing, your brain is growing, you're still developing, and you're in a really important developmental stage. Your developmental stage depends so much on peer input. You don't always care what adults have to say, right? You go to friends first. And some of that has been really impacted this past year. And so some of the things that I've been hearing are that some friendships have disconnected a bit, they've fizzled out, they're not sure like where they stand. So that can create a little bit of anxiety returning. Also having to be present every day at school in the past would make you really socialize with peers, even those you don't like, and teachers, and all that is a really important part of growing up. So returning to school and feeling anxious about it is very normal. There's many adults that feel anxious about returning to the workforce. But I think that one of the things that we're seeing that has been very impactful on teens has been the isolation and low energy. So I don't know if you can empathize with this, or if it has happened to you or your friends, that you're not getting out as much, you're not getting sunlight as much or exercise. So you don't feel as great either. Your energy might be low, your mood might be low. So you might feel very different than you did a year ago. So on the one hand, that's how it's impacted. On the other hand, because your brains are still developing, as we return to something that replicates normalcy a little bit more, you'll kind of catch up. But I think I would say pay attention to how you're feeling, and really reach out if you're starting to notice, this isn't who I am and this isn't how I used to feel, and I'm concerned about myself. Like really reach out to somebody that you feel you can trust for support.
Yeah, that's really, really good to hear. I'm sure a lot of people have had a different perception of how they see themselves before. It's like a pre-pandemic, post-pandemic thing. It's like, I don't know what happened to me, but I'm a totally different looking person, the way I talk or the way I am. So yeah, that's really good to know. What are some resources you think you could probably check out? Meanwhile, if they might be noticing some of these emotions or just want to know in the back of their head.
I think most schools have a counseling department, and as a parent of a teen, I see these emails coming in all the time that counselors are here for you. But you could also reach out to San Mateo Mental Health Access. So that is the portal for mental health through San Mateo County. Whether you have Medi-Cal or Plan of San Mateo, you could also connect through your pediatrician, who might be able to support you to connect to mental health providers. So whether you have private insurance or public insurance, there are supports out there. But definitely check out your school counseling's department.
Yeah, it might be actually what I realized, a lot more easier for you to get those resources where they feel, safe and comfortable to get that with their own privacy. Yeah, thank you so much.
Yeah, and sometimes it's nice to also be able to just call in somewhere anonymously and say, like, I haven't been feeling well. So you could always reach out to Star Vista's crisis line. And so that number will pop up on the screen shortly, because I know if I say it to you, you probably won't write it down, forget it, but everybody has their cameras and they can take a picture of it.
Yeah. I had a question that ran right through my mind. For the other youth, what are some ways you think you really want to promote other youths for getting the vaccine? I know we have this panel and the events happening, but what do you think you might do, whether it be something like today, tomorrow, sometime, or the way you might be a resource, just in general, of how you will be that sort of advocate in the community? And it doesn't have to be some sort of out of the box idea. It can be something really small, and every little thought and action really helps. And we can start with Yvette.
Yeah, so I think spreading resources on social media would be the thing that I would do the most, because I think social media plays a big part of our life as youth. So the more people that see these resources, the more people that click on these resources, the more they can learn. I know some people probably just skip through stories and they really don't click it, but just the thought of putting something out there and knowing that you did something to, I don't know, probably educate someone, it's good.
Yeah, anybody else want to add? I'm actually curious for a lot, because I know you'll be attending college, which means you might be interacting with a lot of different people where it's not maybe a previous network that you've had before, or that, kind of got out of touch during that pandemic. I'm curious how you would go about this.
Yeah, I think thankfully I still connect with many of my friends, but I know for a lot of us, like staying in these friendships and these relationships during the pandemic, it feels like you have to put 10 times more effort in. Whereas when you're in person, you can just have a conversation, staying on social media or trying to text someone or call someone. We all have different schedules, so it's really hard to stay in contact. So a lot of our relationships will fizzle out, or are just they just feel a little bit more distant. So I am, a little bit afraid to go back to like having that awkward conversation, or like, hey, we were friends, like really cool friends, like 1.5 years ago, and we haven't seen each other for that long, or we haven't seen each other for that 1.5 years. Like, is it gonna bounce right back? Is it gonna be elastic back, or is it gonna be kind of a slow fusion back into school? And I do know I'm gonna be going into my last year this upcoming year, so I'll be a senior. So there's a lot of people that have graduated that I've known that I will most likely not really see ever again. So I know that's going to have a big effect on me a lot too, knowing that like those friendships that I had are going to be gone, or I'll have to really put an effort to like reach out to them or stay connected to them, because, you know, I was a sophomore at the time, like having classes with these upperclassmen, and now I'll be the upperclassman having classes with these new people that are entering in and having these new experiences. So I think it'll be very different, but I think that in the end, it'll all work out. I think that we'll have a new sense of community that we'll build, but I think we'll have to see.
Yeah.
But it'll be good.
Quick question we have for our medical panel. Do we have any idea of how San Mateo will, you know, sort of distribute these vaccines for younger kids once they can get that approved? And especially because we want those elementary kindergartners to get back to school. They really love social interaction and nap time. I mean, who doesn't want cookies and cake and like that's the life, you know? This would be for Dr. Nitu.
You know, Shri, it's a great question. I think we all would love to know the answer, but honestly, your guess is as good as mine at this point. The latest information is that the drug companies that are manufacturing the vaccines and they're currently in trials will probably present data sometime in the fall on vaccine data for 5 to 11-year-olds. And so depending on when they actually presented and what kind of the information on like what the dosing is and stuff like that, that will all dictate how it actually gets rolled out for this younger age group. I mean, but the good thing is that we're experts at providing vaccines to young kids. You know, we do it all the time. Think about when you guys were going to the pediatrician and getting shots all the time. So, yeah, so I think it'll be what it is, and we'll respond as soon as we have more information to get everyone that wants to get vaccinated, shots in arms.
Yeah, it does make sense, right? Because we're all finding something new every day, and we even didn't know if we would get a vaccine, yet we figured it out. So we have, you know, top big brain scientists, physicians, everybody on, you know, the forefront on this. So if any youth or really anybody's afraid how they're gonna get, you know, their sibling, their child or family friend back to school that is, you know, 12 and younger, like we'll figure it out, and you can have trust in that process. Okay. Something, I guess, to bring some sort of community connection. Now that we've really dived deep into all these nitty-gritty parts about the vaccine, for the youth, I was wondering what gives you hope in this sort of time, and I guess what you hope will happen in this future time that we're having these, you know, vaccine clinics, other resources being spread, and the county working on it. Do you see light at the end of this tunnel? And we can start with Amaya.
Yeah, so I guess one thing I really hope for is that more people decide to get vaccinated. I believe right now 65% or something of the population of the U.S. gotten their first dose. That may be wrong, but that's what I remember. But I really hope that number increases, and I just hope that like more people can spread awareness. And I guess what gives me hope is like right now there's so much like volunteering and just work like collaborating just to like help people get the vaccine, just raise more awareness. And I think it's just the cooperation element of like everybody in our county and just everybody, I guess, in the US to, I guess, get more people vaccinated and spread more awareness about the vaccine.
Yeah, bringing in the community together. Real quick, before I know anybody else wants to answer, audience, if you have any more questions that you just thought up of, totally fine. Feel free to put it in the comments, and we'll get to them right after this, and then we can switch the audience. But the two other youth that haven't had a chance to respond, I'd love to also hear what you're thinking about.
I can. Oh, do you want to go, Yvette?
No, you can go. You can go.
All right. I honestly have so much hope. Going back to December, November, we did not have like vaccine rollout for everyone or maybe we did last year. I can't remember. But knowing that we have, like Amaya was saying, around 60 creeping up to 70% of people that are vaccinated. That is amazing to me, you know, that many people in our county are vaccinated, which shows, you know, only the numbers are going up at this point. That means there's so many people that are vaccinated. There's so many people that are, you know, taking care of themselves, but also understand that they're protecting the community, your neighbors, your loved ones around you, just so, you know, we can hopefully at some point completely obliterate this pandemic and get back to our new normal, you know. So I have so much hope that things are going in a positive new direction. We have new technology that came out of this, these new mRNA vaccines that are like revolutionary, which is amazing. And I think they started they're trying to fix it into like new treatment for different stuff. You can look into it, but it's outstanding, basically. So I have hope that we're going to have new treatments for other things and new vaccines for other things in our future because of this, you know, new COVID-19 vaccine, and that people are going to look at research and science in a new way, that they're going to take it as a moral obligation, look for reliable resources, and educate their friends and families on it. So I am very, very excited for our new future.
I love how you're talking about people being more educated and, you know, going to sources that they trust. That's so important. I absolutely love that. And last but not least, from our youth panel, Yvette.
Yes, so I'll keep it brief. I have a lot of hope. This generation has absolutely had me mind blown. How quickly they like understand what's going on and how quickly they are to spread resources. I get super happy whenever I go on any type of social media and I see kids my age, kids older, younger. They're posting resources on, you know, on their accounts, and they're bringing awareness. And I love how serious they are about this. And, you know, because everyone wants things to go back to normal. To say the least, I'm really hopeful that hopefully soon we'll be able to go back to the way things were and not have to wear masks and all that.
Yeah, I'm so excited to see everybody's like smiling faces and, you know, actually stop somebody I know and just ask them how they're doing, and versus me trying to leave the Safeway grocery store in a hassle so I can not be outside as much. But yeah, I guess to sort of add my 2 cents, I'm so just surprised by how people are able to step up and take action. This is like not even a local community, it's a global thing. And anybody who can help is making that effort to say, yeah, I can make those masks. Yeah, I can cook for dinner for you because you tested positive for COVID. Or yeah, I can help you out this way. It's really the small things that are building. And I guess I'm also very thankful for the youth for not being scared by what other people might say or what other people might think, or just being like, yeah, I want to help and I'm here. So yeah, I'm so excited for how we can finally bring this to a close. And on that note, I just want to say thank you so much, all the panelists, the youth, mental health specialists, medical panel too, for giving your time and wanting to really push this forward about sharing information about COVID-19 and what the county's been doing. Quick things about resources. We have the clinics happening Tuesdays through Sundays from July to August. You can come by. There's one happening at the San Mateo Medical Center, clinics happening around the county. You can check out those flyers. They're also on our social media platforms. You can check out SMC Health, which will have more about that. Thank you so much for having that pop up there. And we will have, follow the San Mateo County Health, and on their like Twitter, Facebook, Instagram, YouTube. You can even, if you want, All-Star Vista, if you're interested in more mental health resources during the pandemic, or even more about what's happening in the community. But that's all I had for now, folks. Thank you so much for taking the time out of your day to come listen to this lovely panel, and have a great night. Bye, everybody.